name is Ashley Gonzalez, and I'm going to be performing my video practical for my Chem 337 class. I have here with me Maria Gonzalez, which is my little sister, and she's going to be my patient today. So first and foremost, I'm going to start off kind of explaining what the Jones fracture is, which is my ankle injury of choice. I'm going to go over the 3 bony landmarks, the 3 soft tissue landmarks, and then after I'm going to go over the acute treatment, long-term treatment, and then I'm going to do the 3 bony landmarks of the knee, then the 3 bony landmarks of the hip. The Jones fracture is a common fracture of the ankle, and it can be defined as a break between the base and the middle part of the 5th metatarsal of the foot. It results in pain near the mid portion of the foot on the outside of the foot. The fracture typically occurs when the toes are pointed and the foot bends inwards. The common mechanism of injury of the Jones fracture is a laterally directed force on the forefoot during plantar flexion of the ankle and ankle rolling. I will now palpate the ankle and the 3 bony landmarks of it. So first, I'm going to instruct my patient to take a seat. Sit down. I will be on the right side of the patient since I am left-handed. So I'm going to grab her foot, and first I will locate the 5 tarsals. So 1, 2, 3, 4, 5. So this is the 5th tarsal where the Jones fracture commonly occurs. And I am going to put a sticker on it. The 5th tarsal. I'm going to now move inferiorly and laterally and find the base of the 5th. So this bony landmark right here is the base of the 5th. I will now move inferiorly again and kind of superiorly to find the lateral malleoli. And this is the lateral malleoli, this big bony landmark. The next bony landmark that I'm going to discuss is the calcaneus, which is also known as the bottom of the foot, the heel bone, and I am going to put a sticker on that. And those are my bony landmarks. Now I'm going to talk about the soft tissue palpations. So I still have my markers for my bony landmarks, so that'll kind of help me guide into the soft tissue palpation. So first I'm going to talk about the lateral ligaments. So I'm going to use her lateral malleoli as a marker. So if you move kind of diagonally and in front of the lateral malleoli right here, this is going to be her ATFL ligament, which is her anti-tibiofibular ligament. I'm going to put a sticker right there. And if you kind of move down the lateral malleoli, this right here, this is going to be her calcaneofibular ligament. I'm going to put a sticker right there. And if you move posteriorly from the lateral malleoli and kind of diagonally as well right here, this is going to be her posterior tibiofibular ligament right here. I'm going to put a sticker there. Next, I'm going to talk about her peroneus, brevis, and longus, and for that, I'm going to use the base of the 5th as my bony landmark. So if you kind of move right here, like inferiorly from the base of the 5th, kind of a little under, that is going to be her peroneus, brevis, and longus. This is where they're located, her peroneals. I'm going to put a sticker. I'm also going to talk about her plantar fascia, and her plantar fascia is going to be located on the bottom of her foot where her arch is located. So this is kind of like an indication, and where her calcaneus is. So it's about right here. This is where her plantar fascia is going to be. Put a sticker on it. And those are her soft tissue palpations. Now I'm going to talk about the hip palpations, which are 3 bony landmarks. So I'm going to talk about the ASIS, the PSIS, and the iliac crest. So first I'm going to tell the patient to lie face up, so supine. So can you please lie face up? Now I'm going to tell the patient to move his shirt up so I can See his bony landmarks? Okay, perfect. Now I am gonna kind of move down inferiorly down the body and feel for the first bony landmark, which is the iliac crest. So it's gonna be like right here. Put a sticker. So the first bony landmark that I feel. Next, I'm gonna kind of move inferiorly, and wherever my fingers kind of like fall into place, that is gonna be his ASIS, which is the anterior superior iliac spine. Kind of right here. So right here. Now I'm going to instruct the patient to please lay prone, which is face down. So can you please lay face down? I will now put his shirt a little bit up so I can kind of see what I'm working with. Okay, so wherever I kind of feel where the dimples are, that's a clear mark of where his PSIS is going to be located, which is the posterior superior iliac spine. I'm going to put a sticker on it. Just kind of move down towards the body and wherever you feel the first one landmark. And those are my hip palpations. So now I'm going to palpate the 3 bony landmarks of the knee. The bony landmarks that I'm going to palpate are going to be the joint line, Gerdy's tubercle, the tibial tuberosity, and the head of the fibula. So first I'm going to tell the patient to please sit down so I can do this. I'm going to next instruct the patient to roll up his pants. Okay, so first I want to locate the joint line. So the joint line is going to be found when you have your hands palms up and you kind of feel like sort of squishy in the middle. So right here, this is going to be his joint line. From there, I'm going to kind of move inferiorly and kind of diagonally, and right here, this is going to be his Gerdy's tubercle. So from the joint line, I'm also going to move to Gerdy's tubercle. From Gerdy's tubercle, kind of inferiorly, I'm going to feel for the head of the fibula. So the head of the fibula is going to be right here. So kind of a centimeter inferiorly to Gerdy's tubercle. From the joint line again, I'm going to feel for the tibial tuberosity, which is this bony landmark. It's right here. And that is the knee palpations. Also, you kind of want to know where the patella is, and it's right here. So this is going to be the patella. And those are the knee palpations. So now I'm going to talk about some acute treatment with the Jones fracture. So the Jones fracture signs and symptoms are sharp stabbing, pain on the outside of the foot, vibration hurts, tenderness, discoloration, swelling, and weight-bearing walking problem. So I'm going to instruct the patient to sit down so I can explain this. So I would tell her, first I would talk about the Peace and Love acronym. So first, the P's for the acute treatment. So peace stands for P as in protection, so protect the foot. E as in elevation. A as in avoid anti-inflammatory. And C as in compress, and E as in educate yourself. So first, I'm going to tell her to protect her foot. And I have a boot right here, so I'm going to kind of slide her into it. I'm going to move this up. I'm going to place it on her, so kind of tightly. And I'm going to make sure it's super tight where the fracture occurred. Start right here. Super tight. Now, since this injury has a weight bearing problem, I'm also going to tell her to use crutches. So I'm gonna bring her the crutches and tell her to kind of use them. As you can see, these crutches are not to her height. There has to be a nipple to armpit ratio and the arms have to be locked. So these crutches will need to be adjusted. I'm going to also tell her that when she is resting, she should elevate her foot, and as well as, you can sit down, she should elevate her foot as well as put ice on it. So she would remove the boot. And tell her to elevate it with like a chair or something and then ice it laterally where it hurts. And that is acute treatment. So some acute treatment that she can do because she has a Jones fracture and she is going to need PT is alphabet with her fifth tarsal. Yeah, with her pinky toe, try to do the alphabet. So I'm going to tell her to sit down. She is going to put the band inside her foot and she's going to hold it where she feels comfortable, and she's going to plantar flex and dorsiflex. So move your feet up and down. So up, toes pointed up, toes pointed down, toes pointed up, toes pointed down. Okay. I'm also going to instruct her to have her feet flat on the ground, and she's going to move her knees inwards and outwards, kind of to increase the range of motion and that. So this would be part of, in the Peace and Love acronym, it would be part of the love. So love would be load, optimism that you're going to get well, V is vascularization, and E is exercise. So she has to exercise, she has to be optimistic in order to be well.